Welcome to South Today. I'm David Allard. The top stories this lunchtime.
We will hold them to account.
Despite public protests, big changes to healthcare in Dorset are voted through. A&E, maternity and childcare services are all affected.
I'm off the Sussex coast to witness the last of 116 wind turbines being installed 8 miles out to sea.
And the very personal reason why two brothers will be recreating the journey of the cockleshell heroes. There have been protests this morning outside a crucial meeting in Dorset, where a vote was being taken on major changes to hospitals and healthcare in the county. Among the plans were the closure of A&E at Poole Hospital, making Bournemouth the main emergency hospital for the county, and the Dorset County Hospital in Dorchester teaming up with Yeovil for maternity and childcare services. The plans were intended to save the NHS £150 million over the next 4 years. Our health correspondent David Fenton was at the meeting of the Clinical Commissioning Group and he joins us now. So, David, what's been decided?
Well, everything was agreed, David, and unanimously there was no dissent in the meeting whatsoever. Not the case outside. As you said, there were protests going on. Many people here still worried about travel times to the big new accident and emergency centre that's going to be built in Bournemouth Hospital, about maternity and childcare services here in Dorchester, and also about what they see as cuts in general to services in Dorset.
We've got to make sure that people can be near their children when they're sick. This is very, very important.
The time that it would take to get to Bournemouth or to Dorch, it just adds on, you know, it just completely wipes out the whole golden hour.
We've had over 79,000 signatures and the CCG have totally ignored that.
The Yeovil Hospital's in Somerset, Dorset County Hospital's in Dorset, and services should be remaining in both hospitals.
So, David, what was the mood like in the meeting?
Well, there were about 130 people inside the meeting. Most of them, David, I think were probably NHS professionals, and my feeling was they were just glad to have come to a decision finally about these big changes that are coming. We're talking about maybe £85 million investment now in Bournemouth Hospital, £62 million investment in Poole. There are going to be 50,000 people taken out of A&E visits over the next few years, and more people are going to be treated either at home or close to where they live. One final point, there is also a lot of changes in mental health services. 2 new retreats for patients are going to be built, one here in Dorchester and one in Bournemouth.
All right, David, in Dorchester, thanks very much indeed.